So there are alopecia just means hair loss, and there are many causes and forms of hair loss. There are two in particular that are more common and prevalent in women of color. So the first one is something called CCCA, or centrifugal cicatricial alopecia. That's a handful or a mouthful. But essentially it's a form of hair loss that involves the vertex or the top of the scalp, and it spreads outward or centrifugally. It happens slowly over time, and so diagnosing it early is important to help so that you can prevent disease advancement. It's a scarring form of hair loss, meaning that for some people, this hair loss can be permanent. And so that's another reason why diagnosing it early is really important. We see it almost exclusively in African American women, and we're not really sure of why it happens. We have some understanding, but we need additional research and investigation into the area so that we can better understand why it's happening and also to develop better treatments for it. Traction alopecia is the second most common cause probably, or maybe it's even more common than CCCA, but that happens along the hairline or the edges as we call it. And that happens from chronic wear and tear and pulling and styling procedures that we often do. From the time we're young little girls, there are certain styles that are more acceptable, and they cause a lot of traction and pulling. And these areas of the scalp are a little more fragile than the other areas in the scalp, and so there's a lot of breakage. If this is done consistently enough over a long enough period of time, this too can result in permanent hair loss. So again, really important to diagnose both of these hair conditions at an earlier rather than late stage.